Hey, how's it going?
Hi, Naheed. How are you?
I'm good. I'm good. How are you?
Oh my gosh, like all sorts of nervous, but I'm excited to see you and not have to be staring at my face.
No, it's all good. You're great. This is gonna be awesome.
So welcome to the OnCanada Project's first Ask an Expert. We're hoping to do this on a regular basis, and I was so excited that you were interested in being our first person. To anyone just sort of hopping on this now, if you have any questions, feel free to put it in the little question box thing. And I did a quick Google search of you so that I could have something to say at the beginning. So basically, here's what the internet delivered. You are the founder of a palliative education and care for the homeless, or like the PEACH program at the Inner City Health Associates, a faculty member at UFT McMaster, and a personal health hero of mine. I'm so obsessed with the work you're doing and the health justice lens that you bring. You're a founder of the Healthcare in Canada Club on Clubhouse and a millennial, like 50% of our audience here. So that's super exciting. I'm sure I've missed so many other aspects of your life, but do you have anything you want to add before I get into my first couple questions?
Well, what I want to add is it's a real honor to be here, and I think you have been a real force on the healthcare and COVID scene with all the work you've been doing around knowledge translation and really breaking down complicated topics and science for people using social media platforms that many of my friends know and use and love. And it makes too much sense to me what you've done, but believe it or not, it's truly groundbreaking what you've done. And when we look back at this time, we'll look back at this account and see how impactful it was. It probably saved lives, to be honest.
Oh, wow. Well, thank you. I mean, it's definitely a team activity. There's 130 of the most incredible people you'll ever meet, but that means a lot. Yeah. I mean, you are of TikTok fame, though. So this is like social media is your jam. Um, if you haven't seen Dr. Naheed's TikToks, I highly recommend it. They're entertaining and educational, my favorite combination of things.
It's a lovely combination for the on COVID-19 crew. And shout out to the entire team that works with you. I can see it's high quality work, it's evidence based, and it's translating the real world science. So I'm really grateful to be part of this tonight.
Oh, well, thank you. Okay, well, I had to ask a question around health justice and what that means because
All
it's
right.
still something that's a little new for people who are not familiar with it.
Yeah.
So, do you think you can speak a little bit to that and how it's
Yeah.
woven into your role?
For sure. There's probably like a million ways to answer this question. I think the way to talk about health justice is to really contextualize what our Canadian healthcare system is good at. We're pretty good at equality. So giving people the same things to be happy and healthy. And technically, we have a universal healthcare system. Universal, we can get into what that really means. And we're pretty good at equality. What we're not so good at is equity, giving people what they need to be happy and healthy. So that's making accommodations, putting in resources and supports to help people who experience structural vulnerabilities like poverty and homelessness, for example, or the effects of systemic racism, for example. What we're trying to move towards is going from equality to equity to moving towards a space where we actually talk about justice, and that's empowering people to have the resources that they need to make their own healthy lifestyle decisions. And what we've seen throughout this pandemic is how our system strives to be based on equality, doesn't really do equity that well, and we're far from health justice. And so that's one way to frame the conversation around health justice.
Well, I think that's such a great summary of what it is. I think at school, I learned a lot about the social determinants of health, but we never really spoke about health justice. And I think it was honestly your account where I first saw it like that. And I was like, that's a way better way to wrap your head around it as opposed to just looking at it as like an independent thing of like the social determinants of health. It's not good enough to know that. We have to take action on that.
Well, real talk, it's like I think we do an injustice when we talk about the social determinants of health in isolation. Like, I think most people recognize that, over 60% of what makes us sick is social. We know that now. Housing, income. The number one determinant of health is income, actually. Employment, social networks, so on and so forth. But the reality is that if we talk about the social determinants of health in isolation, then what we do is we pretend or send the message out there that those social determinants of health are static, that they cannot change, that they're set in that way. And that's the furthest thing from the truth. What we need to be talking about are the structural determinants of health, which define the social determinants of health. And if you think of a tree, I'm like digging at the roots right now with this conversation. Right. So why do certain communities have better access to healthcare? Why do communities who experience poverty have less access to COVID resources? Why did we see in this pandemic that 80% of people in the city of Toronto who got COVID were people who are racialized, and upwards of 70% who were hospitalized were people who are racialized? This is just the kinds of conversations we need to be having and changing up in our society.
And when you say things like, just because we're into like plain explaining things.
Love it.
When you say like structural inequities, what are you specifically speaking to?
I think, for example, we use the term structural vulnerabilities. And what we don't like is the term vulnerability, because when you say someone's vulnerable, you're kind of pointing at them and saying they're weak. And there's often an inherent, individual kind of blame that's put on that person, or we think that person's weak or they did it to themselves. And I'm thinking of, like, for example, people who experience homelessness, and there's often that stigma that's out there, when in reality, a significant proportion of the people I care for as a physician who provides healthcare for people who live in poverty, for people who experience homelessness, a significant proportion of them are in the situation they're in because of structures around them, because of a weakening social safety net at federal, provincial, regional levels, around social assistance, housing, pharmacare, healthcare, and social supports in general. And so it's time we move beyond the individual and realize that people who are in rough spots in our society are not there because they did it to themselves, but because of the configuration of the structures around them.
I love that. It's giving me chills listening to it. But maybe we could talk a little bit about what that has looked like for the community that you work with, which is people experiencing homelessness, and then more specifically what COVID-19 has done to deepen already existing disparities there.
For sure. So for those who are watching or will watch later, just for context, I'm a palliative care doctor who founded and works on a team that is called the PEACH team, and that stands for Palliative Education and Care for the Homeless. And we're a mobile palliative care team that goes out to streets and shelters and provides healthcare for people experiencing homelessness who are dealing with serious illnesses and are often dying. During the pandemic, I've also served as the Region of Peel's the Region of Peel's medical director for their COVID-19 isolation and housing program. So you might have heard of those isolation hotels that have gone up. I've been, coordinating the medical supports there. And in both circumstances, I've seen the dire impacts of COVID on people experiencing homelessness. This population was living by a thread before, and that thread snapped during the pandemic. And we may have all been in the same storm, but we were not in the same boat. And you don't have to look further than people experiencing homelessness. People have been separated from their medical supports, their social supports. Respite shelters and drop-ins have had to close. And we've seen two things happen. We've seen more people who are living in encampments than ever before. In a city like Toronto, 14,000 people upwards of are in the streets living in tents, and you see the encampments lining cities across Canada. Another thing we've seen is the amazing ability for government, healthcare organizations, activists to work together to inspire change. We, for example, in the Region of Peel, in the first wave, were able to accommodate half of people experiencing homelessness in hotels and motels. And we saw that in cities across Canada. There's been development of isolation and recovery programs. And it's actually quite amazing to see, like, my colleagues across the country who have done incredible work. And I think now that the pandemic, we're looking towards, the end, although I know it still seems very far, we wonder what these programs will become, because we can't just ask people experiencing homelessness to go back to the street. That wouldn't be right. That wouldn't be fair. And so there's a thesis that has COVID shown us that we can cure homelessness in Canada. Can it end chronic homelessness as we know it, because it's a human-made problem? So, just through that answer, just taking you through some of my experiences and how we might envision the future.
Something we actually had someone ask on the account, and I was going to save questions for at the end, but someone asked specifically around, like, what's the difference between a shelter and encampments, and which one is, I'm paraphrasing it now, but like which one is like showing the most dignity to the person accessing the resources?
I think it's a good question. I think it behooves us to discuss that you know, homelessness is a continuum. Canada has one of the most progressive definitions of homelessness in the world. We often think of a static, you know, person panhandling on the corner or living in a shelter as someone who's homeless, but there are people who couch surf in this country. You know, there are women who suffer intimate partner violence and suffer the mental health consequences of that. And actually, homelessness is a continuum, and the people I care for move along that continuum back and forth. You know, an example of a person experiencing homelessness is someone who lives in a shelter. Shelters come in all shapes and sizes. Some are public, some are private, not for profit. Some have different services in there, and you know, it depends, you know, really where you're talking about. And encampments, I mean, encampments have been around, unfortunately, for a very long time. These are places where people go to live in spaces that they define as their own, and that can look like different things. We often think tents, for example, or tent cities, for example. And the idea is that, you know, the right to self-determination, the idea to be able to live where I want. I don't have to go where the state tells me to live, like a shelter. I can set up in a park and I can have my own right to live. In terms of what's better, what derives more dignity, it's not for me to answer that question. That is to be answered, and it's a great question, but I would say the answer lies in the person that we're talking about, the person that we're caring for example. And so there are many clients who I care for who say, listen, like, living in an encampment is dignity for me, like, to me. And I'm gonna live here, and that's what I'm gonna do. You know, that's cool. That's what it is. For others, it's living in shelters, right? So we must not. One thing about trauma-informed care, and that's the kind of care that we try to bring into healthcare, is not project our ideals or values on those who experience homelessness, for example, and imprint them on other people. We just got to meet people where they're at. That's what this is about.
I love that explanation. I actually studied about trauma and violence informed care in my master's. It was the first time I heard of it, and I immediately went, wait, this is not the norm? Like, how is this not what everyone is doing in every part of the world? It just makes so much sense. Could you speak a little bit to that and why it's so important?
It's so wild to me because, you know, like, many people, like, haven't heard of trauma informed care. And then when they hear of it, they're like, why isn't that just the way we provide healthcare for everyone? Actually, it's wow. And like, a lot of people that I work with or train, like the trainees, like, they've heard of it, but they don't know how to do it. So we're trying to convert it from a buzzword to action. So trauma informed care is a recognition that the people that we care for have experienced trauma at the hands of the healthcare system. And it is not right that we put them in situations where they continue to experience trauma. You know, it's everything from learning how to pronounce someone's name to, you know, learning about their appropriate pronoun to, supporting them and not making assumptions about the kind of care they provide. Many would say that the palliative care street outreach team I run is an example of trauma-informed care in action, right? And then there's like policy level, right? Trauma-informed care. So like, you know, harm reduction, you know, supporting people who use drugs, not by telling them to be abstinent, by supporting them by meeting them where they're at through a human rights approach, so that they can use drugs, but reduce the harms in doing so. That is trauma-informed care as well. And I hope it starts to go from buzzword to like action, the way we actualize the work we do more and more, because it needs to happen more and more.
I love that. Yeah. And I guess, like, for our audience, because our audience is like 83% is Millennials and Gen Z. What do you think is something we could be doing to like encourage our policy and decision makers, but also to make sure that these things don't stay as a buzzword sort of thing during the pandemic, and then afterwards just gets lost, including the work that's been proven sort of with people experiencing homelessness? Like, we know it can be like systematically addressed, but like, it can't just stop after. Like, we can't just walk away from it. So what is something that everyday people just watching this or engaging with us could do?
For sure. And I think, like, learn from the lessons of what's been so great about on COVID-19 and your whole team and what you guys have done. And that's, you know, translating information and translating messages. We saw it around, you know, your account around COVID. I've also been so impressed with, you know, people who are under 40 who have used social media to translate complex messages around the Black Lives Matter movement and what it means to be anti-racist. So, I mean, you know, I think it's really behooves the point that it's a time for us to be translating these complex messages and using these platforms to educate each other and spread the word. You know, with that great power of these tools comes great responsibility, though. So there's an ethic and an ethos of doing it right and doing it correctly. And sometimes that means not posting that post that you really want to post because it's not your struggle to talk about. And I struggle with that too as an ally in many, you know, situations. It's sometimes better to be silent or amplify other voices, right? So I think translating those messages are really key. I think also, you know, being using these platforms to be politically active is really important. You know, I've really been impressed with colleagues throughout this pandemic who have advocated for paid sick leave. It is absolutely wild that we have gone through a year of this pandemic, one that has disproportionately hurt low-income, racialized people. And here in Ontario and many provinces across Canada, there is no provincial paid sick leave to support people who are dealing with the gaps. It is absolutely atrocious. In a region of Peel, we have 1 in 4 workers going to work sick with COVID-19 because they need to make money and make ends meet. The government has put them in this situation, and we've seen, you know, people under 40 using these platforms. I've seen it on TikTok. I've seen it on Instagram. I've seen, you know, these amazing kind of like, you know, decks, reflections, you know, blogs, mini blogs that people have been sharing. And I think that's, you know, a real way to do it. And Decent Work in Health is an organization that's on Instagram and all platforms. I encourage you to check it out and just be really active. The third, and I promise I'll end, sorry, is just telling stories. You know, we live in an evidence-based world. You know, I could tell you that people experiencing homelessness are 20 times more likely to go to the hospital, 10 times more likely to be in the ICU, 5 times more likely to die from COVID-19. But I could tell you a story about someone I cared for who was on the street and what happened. And I find that, you know, while the evidence is important, it should drive what we do. Using these platforms and telling those stories, that narrative is so key. And I think that's something to really think about.
I love that. Yeah, that's so much for us to take away with that work on.
Probably too much. Sorry.
No, there's no too much. What's that quote about, like, no one can do everything, but everyone can do something? Like, there's space and work to be done, and it really is like it's going to take everyone doing that to make a difference, which really is like why this project exists to start with. So that's good to hear. Do you mind speaking a little bit to like misinformation in general? So a friend and I were talking about how like evidence-informed information has to spread faster than fake news, which is like hard, but it definitely needs to go on, and like what that's been looking like and how maybe even like people watching this can talk to friends that are either like, I don't think people are bad and negatively sharing that type of stuff. It's just that, you know, sometimes that's all you know at that moment. And like, how do we encourage people to see it from a different way?
For sure. I mean, I think throughout this pandemic from our governments, we've too often seen a one-size-fits-all approach to communications. I think around the time you launched this account, the standard from our governments were to like hold these press conferences in the middle of the day to transmit information about a complicated pandemic that changes every single day. And you were like, that doesn't work for people, you know, my age or even younger. And, you know, my friends are all on like Instagram and TikTok, and, you know, they consume news that way even, right? So you created this account. Well, that's a really good example of, you know, battling misinformation and getting out there. Like while you were doing that, I like started a TikTok account, and I was blown away at kind of what happened. And, you know, even me, like, and, you know, through and through, I'm a palliative care doctor. It's not like I'm a infectious disease doctor, but, you know, but we all have a role to play in this. And I think that's really important. Now, we're at the stage where the accounts like yours are out there. There's Good Samaritans, organizations producing great information. Shout out Unambiguous Science. Shout out Science Sam. Shout out on COVID-19. You guys are doing great work. You know, all of you. But then, you know, there's still misinformation out there. And you will invariably come across like your Facebook feed, or someone will WhatsApp you. These are the worst sometimes when someone WhatsApps you with this misinformation. And I'd like to give people advice that fall into like the 3 C's. It's just like, I think it might be easy to remember. And I think the first thing is to be compassionate. Remember that like there's often like this sense when you get this message, like even the reaction of seeing misinformation, you might get angry, you might get upset. Just realize that there's a huge mistrust of healthcare out there. Racialized people have faced trauma at the hands of healthcare. People are essential workers face trauma at the hands of healthcare by not getting support through this pandemic. So be compassionate. The second is to be clear in your response. So people do deserve the information in a way that works for them around the science. They need it broken down, and you guys do that so well on your account. And I often refer people to your Instagram account because I think it's just like all right there. You might as well, that kind of thing. And then the third is to be creative. So in response to battling misinformation, we need to be creative about our messaging. We need to be, thought-provoking. We need to be really factual yet fun and really stick with people. I don't know what you thought about this, but there was that TV commercial that came out in Alberta. Did you see that? The COVID-19 virus shows up. There's a house party happening, and then this guy shows up in a virus outfit, and he shows up at the house party, and he starts like dancing with people. And there was like, it was around Christmas time, and it was like, there was a lot of debate about, whether this was a good thing or a bad thing. But I'll tell you what, everyone was talking about it. Like nobody like has forgotten that commercial. And that's creative in that sense, right? And whether you like the commercial or not, the point is the creativity, right? So 3 C's, think about that.
Okay, I love that. That's such a great way to combat that. Yeah, I think the compassion one is really big too. Because of that one size fits all approach, the assumption should be made that people are not able or not getting the tailored information that they need. So like, how are they supposed to adapt and figure things out without that compassion component? So I really, really love that. And then I guess also if we can maybe chat a little bit about vaccine hesitancy and promoting vaccine acceptance around the COVID-19 vaccine. Like what have you sort of been hearing from your work and your sort of like circles about what has been like the biggest thing around vaccines and why people are struggling to kind of wrap their head around this one?
I think one of the first things is I've seen some people misunderstand what vaccine hesitancy really means. It does not mean you're like anti-vaxxer. It means you just have mistrust in the vaccine, which is a perfectly normal and human experience that we need to allow people to feel. There is mistrust of the healthcare system. There's the Tuskegee experiments. If you don't know what that is, look it up. Here in Canada, Indigenous children were experimented on by the healthcare system. We still have, anti-Black and anti-Indigenous racism that's so omnipresent in our Canadian healthcare system, not to mention how people with disabilities, people who experience homelessness, and other structural vulnerabilities lead to traumatic experiences in the healthcare system. So why would people trust the healthcare system that has actually caused more pain and hurt them or not met them where they're at? That's where we're coming from. That's where people are coming from. My thing is we need to convert that mistrust of the healthcare system to making the healthcare system more trustworthy of the relationships, to say, listen, we understand the healthcare system has hurt you. We understand your pain, and recognizing that pain and then taking it to the next level in like saying, we recognize your pain and this is how we're going to meet you where you're at. And I think it's wild to me that, low income racialized people, marginalized groups have taken on the highest burden of this pandemic, and therefore and in addition to that have significant vaccine hesitancy. But it's now on those same communities to fund and resource addressing vaccine hesitancy, and that's not fair. That doesn't make sense to me. So we're doing presentations like at vaccine hesitancy sessions. I did one for a Black community group in Waterloo. We're doing Scarborough. We're holding another one for the South Asian community next week, and we're just doing these drop-in virtual sessions, meeting people where they're at. They get to see people of like similar backgrounds as them, grew up in similar ways as them, same skin color in some cases, or speak the same language in some cases. And that's really what this is about. I really am not down with the blaming of racialized groups for vaccine hesitancy. We need to understand why people got to this place and meet them where they're at. That's the only way we'll get through this pandemic.
I 100% agree with that. And I think it's also using that compassion when dealing with this. So Do you feel like that's really happening though? It kind of sounds from your answer that's not, and it does sound like it is really dependent on people of color to sort of make it work. But what's maybe some action items that we can take away as young people, some of which are from those racialized communities? So yeah, like what could we do?
You know, so I'm not seeing a whole bunch from our provincial government. I'm seeing some funding that has been set aside for the federal government, and I want to applaud that. There's some knowledge translation funding that people can now apply for, and that's really cool. But, you know, regardless of what governments are doing, people have taken this in their own hands, and they're doing amazing work. Like community health centers, advocacy organizations, faith groups, cultural groups, you know, local people who know their people, local like BIPOC leaders have stepped up and are making this happen. And accounts like yours are, you know, for events like this are making it happen. So I think that's like, it's just organically happening. Listen, like, communities who have experienced trauma and pain due to, discrimination and stigma have never really been able to depend on institutions for support. So of course we would come through now, right, to support our own. And that's just really what it is. What people can do to battle misinformation in your local communities is, use reputable sources when posting, on your social media accounts, amplify voices that are reputable and trustworthy, use the 3 C's, be compassionate, clear, and creative in your responses to a battle misinformation, and support groups who are doing it on the ground, because that's the only way we'll get through this.
Well, I think that's really good feedback. Do you have maybe a couple minutes to do
Yeah.
a couple questions that we got in?
For sure. Yeah, absolutely.
I kind of forgot about them, so
hey,
I'm glad that so this question's from Ems. How do we take an anti-racist approach in our healthcare system?
Thank you so much for that question. I think the first thing is to listen and understand. There's so much pain in our communities, and recognize, the disproportionate impact that racialized people have in our healthcare systems. Also, we must not conflate issues. Anti-Black and anti-Indigenous racism is by far leading to worse outcomes for these groups compared to other forms of racism. So it's a privilege, actually, as a South Asian, to be able to even talk about this topic as an ally in that way. So I think we need to listen and understand the statistics and the narratives. The second is, I think we need to, collect data and act on that data, because too often we've collected data and we said race-based data is important, but we've done nothing about it. And that in and of itself is an act of violence on communities, because we tell them we're going to collect data and do something about it, and we do nothing. Then we need to develop interventions. And I think anti-racist training is really, really key. Anti-oppression training is really, really key. Trauma-informed care training is really, really key, as we've talked about. So equipping our frontline health workers and institutions to be able to do that work, and then evaluating the whole process. But we will never get there if we don't equip and empower racialized people to be leaders and be leading this process. Too often we've seen it as a tokenistic, acts or tokenism approaches. What we need to do is empower racialized people to be the leaders along this journey, and listen to the communities who have felt this pain. We won't get through without them. Thanks, Ems.
That's such a great answer and a great question.
Yeah. So good.
Maybe
shout out Ottawa Public Health. Your Twitter account is amazing.
Ottawa Public Health is the most incredible Twitter account. I'm obsessed with them and their Instagram. Here's one that's sort of in the chat. How as individuals can we explain the benefits of the vaccines to immigrant parents, grandparents? Oh, great question. And definitely something I need support into. So
for sure.
How would you recommend you come at that?
I think the first thing in any of these conversations is try to understand why someone is coming to you with that kind of opinion that might be, what we might consider misinformation. It might be due to a bad experience with healthcare. It might be to a misunderstanding of like history and things that happened in the past, and that can just be dispelled in a conversation. Or it can be truly because of, trauma associated with the healthcare system. The second is to present facts. And I think on COVID-19, like, you know, I'm not just saying this because I'm like right in front of you, but like what you and your team have done is incredibly important. And it's a total, like, you know, it's a historical timeline of what's happened in this pandemic. And I would present resources like this. Sometimes people are really interested in specifics about, you know, like we're, for example, we've been asked a lot, like, were Black people studied in these research studies, you know, and what proportion of Black people, and like, I encourage you guys to post about this kind of thing if you can, because I'm hearing that question come up a lot, and it's important. Research was done on this group. It wasn't a significant proportion, to be fair, but it was done. I've also heard, for example, you know, people who are, you know, Muslim or other faith groups asking, you know, are there certain elements like, you know, pork products in these vaccines? And, you know, it really can boil down to the actual, like, you know, vaccine itself. And then people are worried about the long-term side effects, or like, how did you get this vaccine so quickly? And people don't realize this was such a pooling of like work and resources that we've never seen this kind of like cooperation before ever in like history. So we were able to do things quicker. So they're fair questions. I think, again, compassion, you know, be clear, be creative, and just don't dismiss people who are asking these questions, and come at it again at different times in different ways. So, you know, maybe on COVID-19 will work for some people, and maybe you'll have to, you know, top it off with a video for other people. But like, use reputable resources and consider it not like a one-time conversation, but like series of ongoing conversations. Those are some things that we've seen work.
Okay, well, we're at 6:30, and I think most of the questions that we've had, we've kind of covered. So I want to thank you so much for being our first Ask an Expert. It was super exciting.
Thank you.
And thank you, everyone, for tuning in. This was so cool to
Yeah,
do.
you guys were awesome. Thank you so much for coming through. Keep up the great work. You will be so remembered when this is all over. I really, really think that you have provided a huge service, you and your team, during this pandemic. And like, the metrics on your account is just one way to look at it. I know lots of people have said, have you seen this? Have you seen this Instagram account? Have you seen what they're doing? And you know, it's huge, right? So keep it up, and anything I can do to help, just let me know, okay?
Well, yeah, thank you so much. And thanks, everyone, for watching. Take care.
Peace out.